My name is AJ Grein. I'm a pediatrician at Rutherford Children's Care in Forest City. I've been a pediatrician about 18 years, but I started in Forest City last June. The Safe Sleep Program was a program instituted by the American Academy of Pediatrics a while ago to help reduce the incidence of SIDS in infants. It's a combination of recommendations that we give parents to ensure that the environment that a baby sleeps in is a safe place for them. It includes babies sleeping on their back, dressed in a onesie or something that covers them completely to keep them warm, but they're not swaddled with a blanket. They're flat on their back in their bed on a flat mattress with a tight-fitted sheet so it can't come loose. And they want to make sure that there's nothing else in the bed with them. No blankets, pillows, stuffed animals, crib bumpers. Any of those things can be a suffocation risk for infants. If you're breastfeeding, which we always recommend is the best way to feed a baby, you want to ensure that the baby's eating plenty. So you put them to the breast every couple hours. We recommend 10 to 15 minutes on each side. And you want to make sure that they're feeding every 2 to 3 hours in the first couple weeks of life. If you're bottle feeding a baby, they're going to start off taking very little, 10 to 15 mLs, which is just about a tablespoon at a time. But as they grow up and by the time you get home, they'll be taking an ounce to 2 with each feed. And you want to do that every 2 to 3 hours as well. The best way to make sure that a baby's getting plenty to eat is count their wet diapers. They should have between 6 and 8 wet diapers a day after the first few days of life. That ensures that they're getting plenty in. Dirty diapers are going to be variable depending on how they feed and what they eat. Breastfed babies can sometimes poop with every diaper, and other times they can go quite a ways between. So dirty diapers are not that important to count. You just want to make sure that the nature of the poop is nice and soft and they don't work too hard when they're going to the bathroom. So going home from the hospital with your baby is a very exciting time, and we want to make sure that the transition to home is a very pleasant and safe time for you and your baby. So we want to see the baby back in the hospital, or back in the doctor's office, at about 2 to 3 days after discharge. And that ensures that everything's going well at home, that the baby's eating well, and it also allows us to check for jaundice, which is a condition that happens in almost every baby. But sometimes it can be severe, and we want to just have the opportunity to check the baby to make sure that the jaundice is not too severe. If it does get severe, it can cause brain damage, so we want to catch it early and give treatment to it before it gets too bad. After that first visit, we'll see a follow-up visit at about 2 weeks of age, 2 to 2.5 weeks of age, and that allows us to make sure the baby's gaining weight well. All babies lose weight in the first week of life, but we want to make sure that they're back to their birth weight by the second week. So that's what that second appointment is for. Then after that, it's guided more by the vaccination schedule. We'll see baby at 1 month, 2 months, 4 months, 6 months.